but I'm here in my capacity as the Chair of the Recommendations Committee of the 15th National Rural Health Conference.
Alright, do you want to start by talking about what's come out of the conference?
So the National Rural Health Conference is unique in the sense that we have what we call a sharing shed, and we urge all our conference attendees, and we had over 1,000 attendees at this conference here in Hobart, to tell us what are the big issues that they see in terms of rural and remote health. And the themes that have been coming out of the conference are very much around the social determinants, the fact that health is more than illness, it's about wellness, and the things that make us well are more than what we see in the health sector. So the conference is called for people to really look at moving out of health and health service delivery as the primary prevention, if you like, or the way of keeping people well, but to think much more broadly and to encourage government and others to think broadly about both what we do to keep well and also the sorts of health system that we want to live in and how we should configure that to meet the sort of aims we want. The aims we want is to manage what currently is a serious health inequality between Australians, and rural Australians obviously suffer from that inequality, and Aboriginal and Torres Strait Islander Australians even more suffer from serious health inequality.
So what are the key recommendations? So
the key recommendations are around supporting and encouraging Aboriginal people to be forefront in decision making about Aboriginal health and Aboriginal lives. And that goes further to an encouragement that communities need to be vitally involved in managing their own health and having some of the answers and being co-designers, which has been a very constant theme through this conference. The other really consistent theme is that we need to be thinking not just about health now, but health to the future. And our rural communities are very concerned about the effect of climate change. They are very aware of the climate changing around them, and that is having impacts on what they do and the quality of their lives. So there is a very important call to government here to say communities on the ground are really aware of climate change, and we're looking for a whole of government response and a way of being able to respond and support ourselves as communities to move with that. So that's going to have health impacts, but it's also going to have huge social and other impacts.
So what will you be doing with these recommendations?
So these recommendations are an incredibly rich vein of community voice that's come from all over Australia. So I'll be presenting those recommendations to Minister Mackenzie this afternoon, but that's the priority list of recommendations, but the total recommendations, and there are around 200 recommendations there in the box, and some of them are pure gold. They're from people who are reflecting on what they are doing and their positions in rural communities and actually offering us solutions, not further advancing the problem. So we're very hopeful that other organisations will look at these recommendations and take up that voice from the bush, and we will be using them with the National Rural Health Alliance and advancing some of them and really encouraging a whole of sector approach, which is what the National Rural Health Alliance is about. But this conference saying, come on, as a sector, let's get together, let's be better together.
Are you hoping that ahead of the federal election, the politicians might be more susceptible to listening?
Well, absolutely, but the things that we're calling for are long-term, all right? They need both sides of politics to be involved. This needs to be above politics. How do we feel about the fact that some Australians live in such abject poverty that they have completely avoidable health conditions? So when I live in Australia like that, I'm exhorting all politicians to have a very long-range view to making Australia more equal.
Brilliant. Is there anything else you'd like to say?
No.
Done.